Hello, everybody. Welcome to the Nicholas Snow Show on PromoHomo.TV. I'm so excited because in this episode, I get to welcome one of my favorite people and talk about the agency that really is keeping me alive. I've been a client of DAP Health for 10 years. DAP Health, formerly Desert AIDS Project, announced its new name and the expansion of its role in public health and health equity earlier this year. While it may seem like this evolution took place overnight, it came after months of internal and external surveys, focus groups, and conversations with thousands of patients, staff, donors, volunteers, and community leaders. And I like to add that it was built upon a foundation of decades of love, service, and commitment. So David Brinkman, my guest today, explains our patient-centered model of care promises patients that we are there for them, regardless of economic or HIV status. This name change will help the public identify DAP as an advocacy-based health center with the capacity and heart to meet our ongoing public health care needs. David continues, "We heard the community clearly when they told us that it was time for a name change, but the history of DAP should not be forgotten in the process. This insight was key to keeping DAP in our new name, allowing us to step boldly into the future while honoring our past." So in this particular episode, we're going to talk about why DAP has a history worth remembering, the agency's plans going forward, and why hope begins with health. So that's coming up with David Brinkman, and he'll be with us in just a few minutes. Now, I would say this at the beginning of all of my episodes, including this one. I want to thank for their support of my show, DAP Health. I do say that at the beginning of my show because of their financial support of my media endeavors over the years. But this episode is not advertorial, and I don't do advertorial on my show. I only have guests on my show that I want to have on my show, and that includes David. Also, for their support, I want to thank 849 Restaurant and Lounge locally here in the desert. And did you know that you are 100% organic as an audience? It means that you found the show because someone thought that you should see it, that it was worthwhile sharing. I didn't pay for it to show up in front of you. You've sought it out because you value what I'm offering. Speaking of what I'm offering, we now have PromoHomo.TV merch on Amazon. If you send me a photo of you in the merch or using the merch, I'll put it in the show with your permission. Now, beginning in June 2021, I'll have a limited episodic series here on PromoHomo.TV focusing on my Living Powerfully with HIV memoir called Life Positive, A Journey to the Center of My Heart. I'm going to do a deep dive into some of the most compelling, provocative, and transformative moments of the book to help bring that story more to life because I think it's definitely deserving of it. And in the story, you'll learn about my global HIV testing safer sex awareness anthem, The Power to Be Strong. It's subtitled on YouTube in 21 languages, and you can ask your smart speaker to play it. You can hear it. Don't do it right now, though, because I want you to watch the show. If you're in casting, and I might be right for you, please check out my acting clips at the link that you can see right there. And finally, you can subscribe to PromoHomo.TV for as little as $3 a month. If you subscribe, if you become a PromoHomo.TV superstar, for a period of time, your name will appear in the opening credits. And as long as you continue to support the show in that capacity, you'll have a listing and hyperlink to the social media of your choice at PromoHomo.TV. And I want you to save the date because I'm the official broadcaster of Palm Springs Pride. I know enough that I can tell you there will be official in-person events happening with Palm Springs Pride, so you're going to definitely want to save the date. And if you're in the greater Coachella Valley and you need further connection to community, check out the LGBT Community Center of the Desert, and there's all sorts of opportunities there. So as I promised, coming up we have David Brinkman, but first let's take a tour of the DAP Health new logo. This is something that you want to read. It's only a minute long, but I just love everything that we can learn in this particular minute. That song totally makes me want to dance, and I did see David dancing in the green room, and I'll be back with him right after this.
Live your life like a dreamer. Fly all over the world. Open yourself so the world can see. You're a beautiful pearl. Live your day like you mean it. And don't forget who you are. You're free to go anywhere. There's no distance too far.
And if you're watching live, I always like to remind you, if you make a comment or ask a question, you may be featured on screen like this. And without further delay, let's welcome to the show David Brinkman. Hi, David.
Hey, Nicholas, I was just checking out your merch. I love it on Amazon.
Oh, thank you. Yes, I've got it right here. The reason I don't wear the t-shirt on the air is because it would interfere with the green screen. You would be seeing through me. So, but thank you for that. And congratulations on the evolution of DAP Health. I know that it's been evolving since it existed, but you've been leading the organization, and I love to identify you as the leader of this evolution. I know you're very humble, and but I think it's important to point out that, you know, you are the leader of this great change.
Thank you, Nicholas. I feel led by our founders who are still a part of our organization today. I feel led through my prayers to everybody who I've lost in my life to HIV. And I feel inspired by this very unique community of volunteers, staff, clients, and donors who make up this organization. We've got an opportunity right here, things we've learned from the AIDS crisis that the broader society needs us to pay forward today.
Well, you mentioned what we've learned from the AIDS crisis, which really put DAP in a very unique position to respond to the COVID pandemic. Would you like to, and since that's been such a significant part of your work in the last year, I was wondering if you would talk about how you were positioned to immediately and powerfully respond, and what the connection of DAP has been to the pandemic throughout this last year.
For people like you and I, HIV has impacted our lives in an extraordinary way, right? Both negative and positive. But for the broader population, HIV didn't necessarily impact their lives. But people like you and I saw what it was like for disenfranchised communities, particularly people of color, African American community, Latinx community, LGBT community, to be impacted by HIV and not find access to quality healthcare, to culturally competent care, to the services people needed to stay engaged in care and afford their care. And so because of that experience that we have lived for the last 3 decades, nearly 4 now, when COVID hit the world, people who had lived through and survived the HIV pandemic had an insight that was fairly recent, right? Starting in the 80s, that gave us access to knowledge and ability to find solutions to caring and treating and testing people who were being impacted for COVID in a way that really, I don't think had been precedented other places in world history. And so just as the question you asked, right? We leveraged everything we've learned, our doctors, our social service team, our behavioral health team, our housing team, and we launched a response to COVID in this corner of the globe.
Well, some people who are watching know that this broadcast is emanating from the affordable housing complex associated with DAP. And I did actually have a COVID test at Desert AIDS Project, and I have since had both vaccine shots at Desert AIDS Project. So I can speak from firsthand about that aspect of the services as well. And I walk by your office every day during my 1 mile walk, which I've done about 28 days in a row.
Nicely done. I'm really, really proud of you. Walking has been the #1 strategy worldwide to fight the isolation and mental health impacts of COVID, right? Think about it. You don't even need to have to afford a pair of shoes to walk. Anybody who is able, right, can walk out their door today and breathe some fresh air, hopefully see some sunlight like we see here in the California desert. And it is such a wonderful way to fight the enormous impact that we have all faced with the isolation in the last 12 months. So I'm super proud of you for walking a mile each day, Nicholas.
Well, thank you. Thank you so much. Now, I know that there was concern by some members of the community about the potential name change and ultimate name change of DAP Health. And that's why the agency, and that's why I wanted to point out in detail at the top of the show how much of a conversation you had. And one of the things that came out of that is the real importance of honoring and maintaining and keeping alive the history of DAP. And I was wondering if you would speak about the specific steps that DAP Health is taking to ensure that.
DAP wouldn't be where we are today if it wasn't from the very hard lessons learned and the battles fought by the HIV community that founded and leads and serves this community, right? And we have a very unique approach to healthcare. For us, healthcare means affordable housing, getting restorative sleep at night, eating nutritious meals. To us, healthcare means dentistry, right? It means access to psychology. There are so many aspects that have created our response to HIV that if we ever abandoned, we wouldn't have the ability to achieve health outcomes for people that are really unprecedented and unpredicted by science. We have been able, as a community, to keep one another alive against all odds. And we want to pay those lessons forward to other communities who are looking for access to health equity. That has been such a light has been spot on it during the COVID crisis.
Well, also part of that history, which is definitely included in your remarks, is that there didn't used to be a Desert AIDS Project. There were people at their kitchen tables and at bake sales and one place after another. And one of the great things that just happened is, and I'm just going to set up a video clip that we're going to play, is, before there was crowdfunding, there were La Dame du Soleil. It has been decades since Steve Chase designed DAP Health's first patient reception area, and since then they have continued to create welcoming and vibrant spaces, understanding the connection between physical surroundings and wellness. You recently unveiled a new lobby conceived by Foley and Stinnett Interior Design in your Barbara Keller Love building. She's resting in power, your friend and mine. And it was transformed to pay homage to the fine art of drag, comedy, and humanitarianism. Clients and visitors at DAP Health's Wellness Wing now experience a space with a life-size photographic mural of the drag troupe Les Dames du Soleil set amidst warm colors and vintage cabaret posters. Douglas Woodmansey and Marshall Percy, life partners since 1976, started Les Dames du Soleil using their gift of bringing people out of their shelves through laughter. With a revolving cast through the years, the troupe helped bring in much-needed funding to DAP, giving people with HIV a chance to access health care, sometimes for the very first time. So I'm going to show you a clip right now, and David and I will be back after it to add further meaning.
So the Les Dames waiting room is for the wellness portion of our healthcare, where people receive acupuncture to treat chronic pain or depression, People see the massage therapist, the chiropractor, the Reiki healer, and the like. And people oftentimes say to me, why is your approach to healthcare so holistic? And it's the chance to tell our story of how we kept our loved ones alive before any medications worth a darn were available. And I think what a better place to honor your role in our community and in our history that shows how when you use creativity, whether it's through building community, building laughter, right, or providing holistic alternative approaches to healthcare, you can achieve health outcomes that scientists don't know about still today. It's extremely important to all of us at DAP Health that we honor the role that La Danse du Soleil has played in the history of the Coachella Valley. It is through the movement of the drag queens that the LGBT human rights movement and the HIV/AIDS movement was able to build a foundation. Before we had the power and strength of our human rights movements, the drag queens of our country stood up and stepped forward to fight to make sure that people were fed, that people could afford their health care. And so this is a tribute to our roots, to our beginning. It is filled with the spirit of the Coachella Valley that is palatable in the halls of DAP, built on love for humanity.
It's wonderful. It's
But no chandelier for people to steal crystals from.
That video just warms my heart, David. It's part of a longer video, not a much longer video, but that is a portion of a longer video. It's just so beautiful.
Yeah, right. You know, we forget that at the beginning of the HIV pandemic, people lost their jobs because they were sick and they didn't have money to feed themselves. And then they lost their housing because of discrimination. And it was people like Douglas and Marshall, the drag queens of our country, who started raising dollars, $1 at a time at the local bars, to care for people who were suffering from poverty and discrimination because they had HIV.
You know, sometimes I'm speechless when I really think back to those years. I was not living with HIV at the time, but my life was forever changed by the HIV and AIDS epidemic because I learned that the most powerful thing I had was my own voice. And I decided to yield my life force in honor of those people that no longer were able to. That was how the HIV/AIDS epidemic transformed my life in the 80s.
And what an incredible job you're doing. I know you said your broadcast is emanating from the affordable housing facility. It's emanating from your heart. It always does, Nicholas.
Well, thank you. And you actually got to tour my apartment recently.
Yeah, I was so impressed with how creative you are, the studio that you have built, and how you have thought of every detail to be able to provide education for free to anybody who watches Promo.TV. Nice job.
Well, thank you so much. And speaking of a nice job, I intentionally wanted to bring up this screenshot of daphealth.org because across the top, you're offering services including primary care, social services, dental, behavioral, sexual health, and so much more. And one of the things that impresses me the most, that stands out for me when I see the video clip we just shared, is all the available alternative medicines that exist within DAP Health that people would historically have had to go elsewhere to find.
Right? When we think about our history and realize that it wasn't until the mid-90s that there was effective medications to keep our loved ones alive, we had to be creative. We had to look at acupuncture to treat chronic pain and insomnia. We had to look to Reiki healers, to massage therapists, and the like. And over time, we have proven that alternative therapies play an incredible role on the immune systems of our patients. And so not only do we use a Western approach through our doctors and nurse practitioners, but we also have a team of holistic healers that are a part of how we manage addiction, how we manage chronic pain, how we manage stress, and the like.
Well, I actually am going to investigate more of that aspect of what's available to me as a client of DAP. Now, one of the things that occurs to me, and you can correct me if you disagree, is that the work DAP is doing is in the context of health, but it seems to be so in tune with the greater context of what's going on in our world on so many different levels. And you're infusing revolutionary aspects of, for example, meditation into health and wellness. You're taking on systemic racism, the impact of poverty on healthcare. There's just basically so many of the solutions that DAP is seeking to find within its organizations are really the solutions that the world needs as well. Would you agree with my insights on that?
Yeah, DAP was founded in a health equity movement based on discrimination and poverty faced by people impacted by the HIV epidemic. And those lessons learned are very applicable to the discrimination and poverty that people are facing today.
One of the huge cornerstone events of Desert AIDS Project, formerly Desert AIDS Project, DAP Health, is the Steve Chase Humanitarian Awards. And I know that the event has been reimagined for this year. A lot of the official news of that isn't out, but I was wondering if you do have any information that you can share.
Yeah, so this year it's on May 9th, which is a Mother's Day. And as gay men, we all know how important mothers are to our community. Whether they're our drag mothers, our best girlfriends, or the women who raised us. And so what a wonderful way to honor them. Steve Chase will be virtual this year. It will air on all of our social media channels, as well as our local NBC affiliate that evening.
Fantastic. And how can people participate? Because I know there also is an opportunity to still donate to Desert AIDS, to DAP Health. How can people continue to give if so inspired and in a position to do so?
We're raising money right now to help our community through the financial and mental health impacts of COVID. We're in a $2 million campaign that culminates on the night of the Steve Chase, and we have $200,000 left to raise. If people have the ability to give and would like to help our community, go to daphealth.org and just click on the donate button. Thank you.
And the address is right there on the screen for people to see. So tell me about I know you're launching, or you've already launched, an awareness campaign about how hope begins with health. Tell me more about that.
So Hope Begins with Health is the campaign that the Steve Chase is celebrating the culmination of. It's a 4-tiered strategy to help our community during these extremely difficult times. We're building a new mental health clinic on our campus right here in Palm Springs, so we can double the number of services we provide to people, whether it be psychology, psychiatry, or addiction services. We're expanding access to all of our healthcare services. We're also continuing our COVID response, both vaccinations and testings, and our hotline. And last but not least, we've launched new creative ways to help end the HIV epidemic through delivering HIV tests to people's homes.
How do people access those at-home HIV tests?
You can access it right on our website, daphealth.org. We will deliver a free test to your home. If you would like to talk to somebody virtually, just like we're doing right now, we're there for that as well.
And is that available simply within Riverside County? Are there geographic limitations to DAP Health's provision of that service?
Yeah. It's for our catchment area, which is the county that we're in.
Okay, so which would be Riverside County for people watching. Fantastic. Is there anything that you would like to talk about that we haven't addressed?
I just want to acknowledge the challenges of the past year and send my gratitude to everybody. It just takes one tree to grow a forest, right? And so many people in our community have stood up to be that one. They've reached out with kindness to somebody they've not talked to in a long time. They've sent text messages just with a heart emoji to one another. They have found ways to role model, such as walking a mile each day to inspire others to fight the isolation. And I just want to acknowledge how the community has come together and found creative ways to show their strength and help humanity through this time. It takes all of us to do it, and I'm so grateful to be a part of the community that you and I are a part of, Nicholas.
Well, I'm grateful to call you a friend, and I'm grateful to be a client of DAP Health, and I love putting this on my screen at the beginning of all of my broadcasts now. I didn't do that historically because I wasn't sure I was allowed to within the terms of service of the platforms where I broadcast to, but once I learned I could put that in, I started doing it. So, not only is the program presented with the support of DAP Health, so am I.
And if we can be helpful to any of your viewers, please do not hesitate to reach out to us. New people join us every day to be part of our healthcare home, and we're honored to care for them.
Well, the address once again is on the screen, daphealth.org. And as usual, David, I thank you for taking the time out of your busy schedule to be on the show. Please call upon me when I can be of service.
It's an honor to be with you as always, Nicholas. Thank you.
Thank you. Have a wonderful day.
You too, my friend.
And I want to thank all of you at home for watching. And if you're outside of Riverside County, I know that you probably wish right now you lived here so you could be a client of DAP Health. I know I'm grateful that they're there for me, but you know what? They're there for around 9,000 people from all walks of life, many of whom come from poverty, from major challenging circumstances of all kinds. And it's just, I am a white gay male. I am part of DAP's demographic, but over 50% of DAP Health's demographic now are people who are not living with HIV. They're going to DAP for complete, total health care at all levels. And I just want to stress that I partake in regular mental health counseling, sometimes with providers at DAP Health, sometimes not, but that's an important part of my life. I see a nutritionist. I've qualified to use the food bank from time to time. I go to the dental clinic. I have a case manager. There's just so many things to be grateful for. Jack is chiming in saying, what a great conversation. Thank you, Jack. I appreciate that. And for those of you at home, once again, thank you for watching, and I will see you next time.
Oh, oh, oh.